Hello friends, I'm Jeremy Stokely, and the topic I chose for this presentation is violence against healthcare workers. So community, for the purposes of this project, is going to be the emergency department. And the core of the patient care structure is going to be the doctors, middle levels, so the PAs and nurse practitioners, the nurses, almost more than anything, and then patient care techs. And then if you extend that out a little bit, that's going to include radiology, lab, registration, and then extend it even further, you're looking at administration and anyone else involved in just making hospitals run in the day-to-day operations. The hospital I currently work at is Wesley Woodlawn and ER. It's an extension of Wesley Medical Center in Wichita, Kansas. The hospital was founded by Dr. Galicia in 2001. It used to be Galicia Heart Hospital. Then they eventually added an emergency department. And then in about 2014, Wesley acquired it. And Wesley Woodlawn, the emergency department itself, has 14. There's a couple trauma rooms. The majority are regular ER rooms. And then there's 4 ready care rooms, which is just for your non-urgent patients. The Wesley Woodlawn campus has been recognized for patient satisfaction in the ER a couple of years in a row. And Woodlawn itself is not a trauma center, but the Wesley main campus is a level 1 trauma center, certified stroke center, all the stuff you would expect a big hospital to be. And if need be, of course, we can transfer patients there pretty rapidly when need be. And the biggest advantage of going to somewhere like Wesley Woodlawn over the main campus is it's not quite as busy, and you'll usually get in quite a bit quicker to see a provider. When I initially started this project, the quote-unquote group I was going to focus on was the patients that were being violent against healthcare workers, but after thinking about it, it makes more sense for the sake of this project to look at the actual people who take the harassment and abuse, which would be the nurses and doctors. So you might ask yourself, are nurses healthy themselves? Well, nurses, like everybody else, come in all different shapes and sizes. And everybody knows in the ER there's a candy drawer, somebody's always bringing donuts, there's always snacks, and it's an impossible place to be on a diet, or at least stick to a diet on. Plus, we crush coffee and energy drinks like they're going out of style, so are we healthy? Not really. Sometimes, but not mostly. What about mental health? I think most nurses deal with the stressors of the ER with a twisted sense of humor, which is pretty universal, and knowing that we're all in this together. Do we self-diagnose? All the time. I think when most nurses are actually sick, though, they're smart enough to go to the doctor, even though they might put it off longer than they should. And instead of asking if health is a right, because that's a whole other can of worms I'm not going to open, what about a healthy work environment? Ideally, in a perfect world, that should be a right. We should work in a place free from violence, free from harassment, free from discrimination. But unfortunately, that's not how it always goes, which is the basis for this whole presentation. Now, it's no surprise that nursing is pretty much dominated by females. It's only a little over 9% are actually male, and that's tripled from about 3% back in 1970, so slowly but surely there's more of us jumping in the profession. Wesley's mission statement is, above all else, we are committed to the care and improvement of human life. That could mean a lot of different things to a lot of different people depending on what area of nursing they work in or what area of the hospital. But in the emergency department, a nurse committed to improving human life is going to be doing 12 things at once, rapidly while remaining calm, collective, and constant communication with the family with regards to lab, procedures, meds, and their disposition. So what's the issue? Violence in the workplace, especially a hospital, even more specifically in the emergency department, is unfortunately an actual issue. A survey done by the American Nurses Association found that 62% of nurses have had personal experience with physical or verbal abuse on the job, and 1 in 4 said they've been physically assaulted at work. That's over half. And that was just nursing in general, but in the emergency department, 76% of ER nurses have reported workplace violence. 7 out of 10 ER docs believe emergency room violence is increasing. And one of the most disturbing stats is that possibly only 30% of actual violence is getting reported by nurses. So the big question is, what can we do, if anything, to help decrease violence in the hospital? In the past, as well as currently and in the future, prevention is always going to be the best way to stop this from happening. What's unfortunate is places that have had higher incidences in the past were because there were barriers in place for whatever reason. And according to the Emergency Nurses Association, who researched this topic pretty significantly, it was reported that violent incidences against nurses were higher in facilities where barriers existed. Some knowledge barriers included administrators keeping incidents quiet in an effort to prevent negative customer service reports, and the perception that reporting brought retaliation from administrators, unit managers, and other staff. Looking more towards the future, while it is a felony to physically assault healthcare workers in some states, that's not the case in all of them. There are several advocacy groups that have and currently are trying to get legislation passed to help curb the violence. For example, the American College of Emergency Physicians have sent letters of support for the Workplace Violence Prevention for Healthcare and Social Service Workers Act, which asks Congress to consider how emergency departments are staffed to ensure that the main provisions of the legislation could be appropriately implemented. Basically, that bill would make employers more accountable for the safety of employees. Another example is the Silent No More Foundation. They have proposed legislation that would make assault against healthcare workers a felony. They would also make it to where there must be anti-retaliation protections in the place so healthcare workers may receive the same basic rights as any other assault victim. So HCA, who actually owns Wesley, has a decent policy in place with regards to workplace violence. Their policy states that safety and security in the workplace is everyone's responsibility. So if there's ever discussion of weapons or bringing them into the workplace that needs to get reported, someone's displaying overt signs of extreme stress, agitation, resentment, anger, hostility, or they're making threatening marks, that's stuff that needs to get reported up promptly. It goes on to state that if someone is affected by any kind of workplace violence, they're entitled to any kind of treatment that's needed through workman's comp or counseling services through the employee assistance program, or the employee will even be paid at their base rate for time that they need to take off to pursue any kind of prosecution. So some things that the Wesley ER community does pretty well is there's a pretty good relationship with security. At the main campus, there's always security present in the emergency room, or at least at the entrance. At the main campus, they're usually there, but they rotate throughout the hospital. And that's not always the case, because I've worked at some hospitals where there's no security, and others where the security was, I don't want to say laughable, but laughable. I've been pretty fortunate that most places I've worked, the physicians and mid-levels are quick to back up the nurse if a patient starts to get agitated. They'll quickly come in the room to kind of help de-escalate the situation. And finally, another good strength is that there's actually a policy in place with regards to workplace violence, and that administration should be supporting the workers, and that crisis prevention training is required for employees. Which brings me to my first weakness. Crisis prevention training is usually required for employees of the hospital, but never as a traveler have I ever been required to do any kind of crisis prevention training or de-escalation training. And if you don't use it, you lose it. The only time I've ever had that kind of training was when I was employed by a hospital, 8 years ago. Not a huge deal if you're the only traveler working in the department, but I've worked in ERs where half of the staff were travelers, so there could easily be a lack of knowledge should a situation arise. One way to remedy this situation would be to have it be a requirement for a traveler before they start there. So put it on the traveler's agency to make some kind of de-escalation training a requirement, and that would not cost the hospital anything. It'll cost the agency something. Another issue or weakness is most nurses, I think, including myself, feel like being verbally abused is just part of the job, and we feel like there's nothing we can really do about it. Sometimes it seems like the only thing we can do is just do our best to de-escalate the situation. And this isn't just a ER issue or facility issue. It's an entire culture issue, because we live in a society where people feel like they're entitled to everything, and because of that, they feel like they can treat people like garbage and still get what they want. It doesn't take a scholarly article or peer-reviewed research project to know that. It takes about one shift in a busy ER, and you'll be a believer. And unfortunately, I don't know that I have a recommendation of how to fix that, because all the money and funding in the world isn't going to fix someone who grew up in a broken home or is just a jerk or mean. And finally, I don't know that I've ever actually seen a nurse report up when they've been verbally abused, or if they've somebody's tried to assault them, and that just comes back to the fact that I think, unfortunately, we think it's normal. Fortunately, there is a policy in place at my facility for that situation. It's just I don't know that all the nurses are aware of it, or even if we are, will we even do anything about it? As far as some recommendations, one study in 2017 showed that workplace violence can be decreased with appropriate interventions, and some examples are listed there. Things like de-escalation training, which I asterisked because I think that's one of the most important ones. Being able to talk somebody down who's agitated, and then things like panic buttons, if there's not security readily available, frequent rounding by security, just that type of stuff. That doesn't really cost money, but is totally doable. All right, that pretty much wraps it up. Thanks for listening.